It is my honor and privilege to have the opportunity to recognize Lyme disease awareness. This particular proclamation is to recognize Lyme disease Awareness Month, which was actually in May, but we are recognizing it now because of its significant importance. A trip to a park, a trip on a trail, playing in a backyard, can have life-altering implications because in many ways of Lyme's disease. Lyme and tick-borne disease have been around for decades. However, little is still known about these life-altering illnesses, particularly how to properly diagnose, manage, and ultimately treat this challenge. In the United States, the Center for Disease Control estimates that approximately 475,000 new cases are confirmed each year, but this number may increase. Lyme disease bacterium, otherwise known as Borrelia burgdorferi, is spread through the bite of an infected tick and can attach to any part of the human body and cause Lyme disease. According to the Global Lyme Alliance, Lyme disease is a complex infection that can affect various systems in the body, including the joints, nervous system, heart, and skin. Many of us have loved ones or colleagues experiencing this extraordinary challenge. And it's just important to note that we are here for you. And this is something that we need to bring awareness to, not just in our community, but across this country. Unfortunately, without expanding a ring-like rash, which is the hallmark or the bullseye rash, Lyme and other tick-borne illnesses often go undiagnosed and untreated, leading to deep-seated infection and long-term impairments. Often known as the Great Intimidator, Lyme disease has more than 100 symptoms, which varies from person to person and emulates other illnesses, complicating diagnosis. Common symptoms such as fever, chills, headache, fatigue, muscle weakness, and in more severe cases, hearing loss, facial paralysis, and long-term heart implications can severely impact the quality of life for those suffering from this disease. Advocacy organizations such as National Capital Lyme Disease Association empower families across Maryland, DC, and Virginia and improve the quality of life for people suffering from Lyme disease and other tick-borne disease by providing education and support. We are very fortunate to have this morning joining us Ms. Monty Scull, who serves as the Executive Director of NatCap Lyme, to make some brief remarks this morning. Monty, if you could take it away, please.
Thank you very much for that nice introduction, Councilman Albornoz. I represent the National Capital Lyme Disease Association, and I'm here today to say how grateful we are to both you and the Montgomery Council members for introducing the Lyme and tick-borne disease proclamation to raise public awareness about ticks and the diseases that they carry. As you mentioned before, Lyme disease is considered by the CDC to be the fastest growing vector-borne disease, infectious disease in the United States today. Close to 500,000 cases were reported by the CDC last year, and that was only considered to be 1/10 of the number of cases that we know occur on an annual basis. Years ago, I sat on a task force with Ike Leggett in your county, and then Olna Tillman, who was head of the health department, and we worked for over a year to come up with recommendations to the council to do for Lyme disease to create public awareness about this situation. At that time, the CDC was reporting 100,000 cases a year. Now they're reporting close to 500,000 cases. That shows you how this problem has expanded. And Maryland has not been spared from this epidemic. You are in the top 10 states across the country for reportable cases. And this is why our organization feels that greater public awareness of this disease fosters better prevention and early detection. I can't stress enough to you all how important early diagnosis is and early treatment. They are essential if you want to find a cure for this disease. So this proclamation that you are introducing today will benefit your citizens of Montgomery County. This measure, why? Because this measure creates an official recognition of the problem still. It encourages Marylanders to learn about these diseases, to take tick-borne diseases seriously, to use aggressive prevention measures, and to seek early treatment. And again, early treatment is key. So on behalf of all the residents of Montgomery County that are affected by a tick-borne disease, NatCap Lyme gratefully acknowledges the Montgomery Council for its effort to bring awareness and to the ticks and the diseases they carry, so that Montgomery County residents will know how to properly protect themselves so that they don't get sick from the bite of a tick. So we thank you all very, very much. We're so grateful. And you might consider in the future, having another task force, because the problem has grown substantially. And we call ourselves the voice for Lyme disease. You can see that in back of me, as you are, Councilman Albornoz, the voice for the voiceless. We are the voice for Lyme and tick-borne diseases. So we are here to do everything we can to help you get the message out to your residents. So thank you very, very much.
Monty, that was extraordinarily well said, and I think you're right. We should follow up on that great work. I had the opportunity to work with Dr. Tillman personally in the previous administration. Huge loss on so many levels, and I remember her leadership on this issue, so I'd like to take up that torch again. Thank you for that. All right, we're going to read the proclamation now. Proclamation of the Montgomery County Council. Whereas Lyme and tick-borne disease are multi-stage, multi-systemic illnesses and have become one of the fastest growing vector-borne infectious diseases in the United States and across the globe. It is estimated that approximately 476,000 new cases are diagnosed each year, and in 2019, 135 Lyme cases have been identified in Montgomery County. However, this local statistic may increase due to the unknown complexities of this disease and inaccurate testing. And whereas, according to the Center for Disease Control, Lyme disease bacterium, otherwise known as Borrelia burgdorferi, is spread through the bite of an infected tick and can attach to any part of the human body, often found in hard-to-see areas such as the groin, armpits, and scalp. And whereas Lyme and tick-borne disease are also exacerbated by climate change, the Environmental and Protection Agency has found that warming temperatures associated with climate change are projected to increase the range of suitable tick habits and are therefore one of the multiple factors driving the observed spread of Lyme disease. And whereas proper diagnosis is vital. If diagnosed and treated early, many patients recover. However, if this infection is not diagnosed or treated early, Lyme disease can develop into a chronic illness that leads to long-term serious health problems, reduced quality of life. In rare cases, Lyme disease can result in death. And whereas by practicing good tick bite prevention habits, by wearing light-colored clothing, such as well as long pants, long sleeves, high socks, and closed-toe shoes when visiting wooded areas, applying EPA-approved tick repellent, and examining yourself and your pets, which is very important, for ticks daily. These are the best ways to prevent Lyme disease and other tick-borne illnesses. Now, therefore, it be resolved that the Montgomery County Council of Montgomery County, Maryland, hereby recognizes Lyme and tick-borne disease awareness. And be it further resolved that the County Council reaffirms its commitment to promote public health and environmental sustainability in partnership with our local, state, and federal partners to ensure the well-being of our county residents directly impacted by Lyme and tick-borne diseases. Presented this 15th day of 15th day of June in the year 2021, and this is signed by myself and our council president, Tom Hucker. Monty, thank you. Keep up the great work, and I look forward to following up with you on your suggestions and recommendations.
Thank you.